And joining me now is our International Affairs Editor, Armen Georgian. Armen, with this fast-moving, highly transmissible variant of COVID-19 wreaking havoc in England, what is happening in terms of border controls here in Europe?
Well, the UK Minister for the Cabinet Office said this morning that something will have to be done very soon at UK borders to make sure that borders are safe. That was Michael Gove's comment this morning. But the incredible thing, Annette, is that why is he saying this now when we've now had a year of essentially no screening in the UK for passengers coming into the UK? And this was a scandal already back in April when the health minister had to admit on a British television programme that there was no checking of passengers coming into UK airports. It's amazing that this is still the situation a year into the COVID crisis. Admittedly, Eurostar has now taken more measures. They now do require a PCR COVID test on both sides. So if you're coming into the UK and then coming into the Gare du Nord in Paris, for example, you do need a negative PCR test. So that's new because that wasn't in place in late last year. But of course, the big problem is, Eurostar, we now have something like 3 Eurostars a day between France and the UK. The big worry in it is, of course, flights, because you've got a much bigger volume of traffic if you take collectively all UK airports and arrivals into the UK. And on that point, I want to quote a tweet from an aviation analyst, Alex Macheras, and in this tweet he says, given that the UK is unable to safely manage the inbound and outbound flow of passengers from around the world, as there are no measures in place, any progress from #lockdown 3 will be wiped out by either re-importing COVID-19 or by allowing new strains to enter without any detection. So very pithy summary of the problems there. And of course, we've heard about these possible new strains, maybe from South Africa or other countries. So once again, this is airports is really the big issue right now.
And what is the current situation here in France in regards to that new strain?
Well, we've been told that there are around a dozen cases of this more contagious variant, Annette. But of course, this immediately, I think, reminds us of the situation in early March when we were told there's only a small number of cases. 1 or 2 people have suffered or have died in the Oise region north of Paris. We now know that in reality the virus had spread much more than was thought at the time. So when we're now told a dozen cases of the more contagious variant, one has to, of course, wonder what the real number is. Presumably much higher. The French health minister has been talking on French radio this morning about the situation in France. Let's take a quick listen now to Olivier Véran.
Now we're at 500,000 doses delivered a week by Pfizer. On Wednesday, we'll be approving via the European Medicines Agency 500,000 doses of Moderna a month. We're also expecting other vaccines. We're getting all the doses necessary to protect French people.
So he's talking about vaccines there because, of course, France, the government has been criticised for the relatively slow rollout of the vaccination program here. And the big danger, I think, in France and going forward, if we're thinking about a possible third lockdown in France, is the combination of, as I said, comparatively slow rollout of the vaccine in France with this mutant strain of the virus. Those two things coming together could obviously be very concerning. Just a quick note to end on the numbers. Although Olivier Véran is saying there that we're going to exponentially increase the number of vaccinations in France, so far France has vaccinated a few thousand people, we're told. That compares with 230,000 in Germany, more than 110,000 in Italy, and of course nearly 1 million in the UK, which started the programme a lot earlier.
Armen Georgian, thank you for that.